Cloudcast Media. Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg of Cloudcast Media, and one of our frequent guests. You can't talk enough about the great work that Father Joe's Villages is doing, and they're going to be on as long as they keep on saying yes to being interviewed. And my good friend, Deacon Jim Vargas. Well, I was trying to figure out, 25 years we've known each other?
25 years.
25 years.
Long time.
Yeah, it is a long time. And you still come back for more. That's wonderful.
I enjoy it.
Deacon Jim is the president and CEO of Father Joe's Villages, and joined by his colleague, the Chief Health Officer, Dr. Megan Partch. How you doing, Megan?
I'm great. Thank you so much for having us today.
Absolutely. And joined by our top-notch curiosity shipper. As our listeners know, we don't do internships. We do curiosity ships. And that is Kamara White, just graduated from Mount Carmel High School. She'll be going to St. Martin's College in Washington State as a communications manager. So she's my guest host on it. And I think Deacon Jim, she's got a question for you right out of the gate.
Sure.
Yeah, so what is the mission of Father Joe's?
Pure and simply, it's to break the cycle of homelessness one life at a time. And of course, it seems simple, but homelessness is complex. It's complex for many, many reasons, and that's because people are at different stages out of their state of homelessness. And so some of them have health issues, and so that's where our federally qualified health center comes in. And Dr. Partch is the chief health officer there, and she can tell us about the various activities that go there. But if you don't have your health, you're not good for much of anything else, right? And that's very, very important. And then there's also our therapeutic child care center, and that helps children come to us. Typically, they're academically, emotionally, and socially delayed. And so we work with them, we work with their parents to build familial relationships. That's an important element, and help mitigate their circumstances, because if we don't do that, then they're 4 times more apt to be homeless in adulthood. So that's an important element as well. The great thing about children is that they're very resilient. So you apply the right resources, the right compassion, and it's incredible how they bounce back. And then the employment. You know, we all need employment, because with employment comes income, and with income comes self-sufficiency. So we have our employment center that helps individuals with marketable skills. We have certificate-bearing courses in the different disciplines, culinary arts and welding, property management, facilities management, and the like. That's all very, very important. We have shelters. Shelters are important. We have over 1,000 shelter beds, and it's not enough, and we can talk about that. But then we know that a shelter is not a home. A home is what we have in as an example, St. Teresa of Calcutta Villa, which is 407 homes within a 14-story building. Right? That was the largest of its kind ever in the history of the County of San Diego, and we opened that building up last year in February of 2022. Over 500 people have been helped. That breaks the cycle of homelessness. I give God the glory, of course. Right? He helped us to do that. And so it's all this, it's our comprehensive services that basically help us to achieve our mission. So that's a whirlwind of an explanation.
No, it's a great explanation. And, we know, Jim, you've been, coming on. How many years now you've been at Father Joe's?
8.5.
8.5 years. And, of course, you can't turn a page of a newspaper or turn on the news or listen to us talking about homelessness. And we should be. Sometimes it's good stuff that they're talking about that we really need to work on, and some people that are ignorant about what's going on with homeless. Before we turn it over, to Megan, you and I do this quite a bit on the show, and I really think I had this conversation with someone yesterday. I said you were going to be on the show, because you ask him a question is why the overwhelming majority of people that are homeless want to be homeless. And I said, you're a moron, and but I'm going to still ask that question, but I won't mention the name of the person who said that. Can you debunk that myth?
Absolutely. We find that the vast majority of individuals do not want to be on the streets. Now, that doesn't mean that they want to be in congregate shelter.
Right.
And the vast majority of beds are congregate beds. And that's why we at Father Joe's Villages have been advocating for well over 2 years for having other things other than congregate settings, right? So that we have people who are able to come off the streets and have some sense of privacy. We like to stay in a pallet type of structure or tiny home type of structure. Still temporary in nature, still just a shelter, right? But it's the conduit off the streets, and then we can start working with them on the comprehensive services. That's an aspect of it. Others also, by the way, have been around substance use disorder, and they don't want to be around that element. And so that's why we have sober living areas as well that are funded philanthropically.
Right.
And those beds are oversubscribed, actually, because people want that type. And then on the opposite end, though, Drew, I have to tell you, there are those who are mired in substance use disorder.
That's right.
And we know when people have that type of affliction, I'll call it, their brains are fried, their brain chemistries are changed, and then they're not capable of making rational decisions. And so we have to meet them where they are. To expect the level of sobriety on their part means that we're relegating them to the streets, relegating them to death. Give you a statistic. 2019, less than 100 individuals died on the streets of San Diego. Less than 100. One is too many,
right,
but less than 100. The most recent count is almost 600, half of whom have died from drug overdoses.
Fentanyl
is a big culprit in that, right? So we're losing our people on our streets. They're dying on us.
Right. And I brought this up to somebody yesterday, a different person who had the idiot statement, and talk about how you folks, with Norcon and all that business. And I said, Jim says something that I happen to agree with. I can't help them when they're dead. I cannot help them when they're not with us. I can help them when they're still alive, if they need the help and all that. We're chatting with Deacon Jim Vargas. He's the president and CEO of Father Joe's Villages, joined by his chief health officer, Dr. Megan Partch. I'm Drew Schlosberg. You're listening to another edition of Drew Schlosberg Spotlight on the Community Show, joined by my guest co-host, Kamara White. And I know you've got a question for Megan.
Yes, so we were talking a little bit about substance abuse and everything. So how does this tie into harm reduction? What is harm reduction? And just tell us more about that.
Certainly. That's a great question. So harm reduction is really based upon each community and the individuals within that community. So harm reduction doesn't have a set definition. Mm-hmm. When we think about harm reduction, we're looking on the whole about decreasing the risks of human behavior to the individual, their family, and the community that surrounds them. So we have harm reduction throughout our lives and our world, and we may not realize it. When we get into a vehicle and we put on our seatbelt, that's harm reduction. When we go to the beach in San Diego and it's so beautiful and it's so hot out lately and we bring a lot of water with us and we put on sunscreen, that's harm reduction. When we put shoes on our feet instead of walking around barefoot, that's harm reduction as well. If you go to a work site and you put on a hard hat, that's harm reduction. So harm reduction in the realm of substance use disorders takes into account that individuals within certain communities will use certain substances in different ways. And that would be different from San Diego to LA to San Francisco to New York. In San Diego, we find that a lot of individuals, unfortunately, are using higher level illicit drugs. They're using methamphetamine, they're using heroin. Many of the substances are being cut with fentanyl. There's also a newer substance, xylazine, that we're seeing the impacts of. And so in many circumstances, folks are using substances that are much stronger than they believe. And so a lot of harm reduction that we're focused on right now is bringing information to people, providing education. If individuals know what they're using and how much they're using, that might help them to make better decisions. So one of the ways we're focusing on harm reduction right now at Father Joe's Villages is through not only outreach and education, but we're also providing testing strips. So if individuals know what's in the substance that they're using, they can either make better determinations about whether they want to use it, how much they want to use it, is it wise to use it all? So having those frank conversations about, hey, we're finding in our drug supply that there is evidence of substances that are leading people to premature death that they were not expecting. Those are some of the ways that we're able to reduce harm right now in our community. I think you'd referenced Narcan as well. And so naloxone, which is an opioid overdose reversal medication, that's something that we're also getting into individuals' hands and saying, hey, if it's not for you, if it's not for a friend or family member, let's all look out for our community members around us. How can we assure that we're reducing this unnecessary loss of life that we're seeing in our community? Mm-hmm. And that's not just for individuals experiencing homelessness, though there is a disproportionate amount of individuals experiencing premature death in our homeless population. This is everywhere. And we're seeing children, we're seeing elderly individuals. really nobody in our community is exempt from substance use disorders or the use of medications. And so we want to assure that everybody around us, including those who are most vulnerable, especially those, are safe.
So you mentioned that in San Diego. My question to you is, they're using these more intense drugs, fentanyl or whatever the case may be, in this new one you mentioned. Why is that? Is it just San Diego, or is it happening all over the country?
It is happening all over the country.
Okay.
It's a great question. So we're seeing an uprise in it in San Diego most recently. Xylazine is one of the newest.
Right.
And, we had some outreach team members who went out a week ago providing harm reduction supplies, and they were providing information on it and asking people, do you know that this is showing up in our drug supply? Many individuals that they encountered said they didn't know what it was.
Wow.
Because again, they're receiving a substance, they're using the substance with an intended use, and they believe that they know what the impacts of the use will be. And if they aren't well educated about what's ending up in our drug supply right now, there are unintended consequences to their use.
Yeah, without question. So are those the street teams that Megan's referring to that are going out?
Both the street health teams, and that's within the Village Health Center, basically.
Okay.
And then we also have just regular outreach individuals also who go out and touch base with those who are on the streets, trying to get them into shelters.
Yeah, and this literally is something that's growing. We know that, and I know the paper reports. Where's the homeless count? We had 85 people that got housed and 110 didn't. So, the number goes up, whatever the case may be. And Jim, talk a little bit about, and you add to this too, Megan, how closely you work with law enforcement.
We work very closely with law enforcement. In fact, we had a Lieutenant Jimenez who happens to serve on our board. Speaking to our security team just yesterday, we have to work closely with the San Diego Police Department. I mean, there has to be a collaboration there. We depend upon them; they depend upon us. I mean, so it's a symbiotic relationship in a sense.
Right.
They are, I feel for them sometimes, for those who are law enforcement, because they also feel as if their hands are tied in many regards, right? So they want to do the right thing. They want to help people off the streets. It's not a matter of just issuing citations or taking them in to a jail cell. They know that's not the answer. And so it's how do we work together in order to help people off the streets and into better situations?
Right. And then, Megan, with that, certainly the new law, ordinance, whatever we want to call it, of no tents on the street or on the sidewalks and all that business, that has kicked in already, correct?
Correct.
And what is the impact on that?
It's a great question. So if I was to look out of my office window last week, I saw a number of individuals and their homes and their pets and their belongings. And while it is heart-wrenching to see individuals residing on our streets without access to basic needs, living in such a vulnerable nature, I at least knew that they were with us, that we could serve them, that we could outreach to them readily, and that they had ready access to restrooms and running water and meals and healthcare services. I look out that window this week, I don't see any of those individuals. The two individuals who are homeless veterans with their motorized wheelchairs, I don't see them there anymore. And so I do have concern about where they might be in our community. For those folks that we'd established rapport and relationships, we're struggling to find where they are and how do we reconnect with them and rebuild. And so it's a new time that we're in, that we need to learn as a service provider how to continue to engage with individuals who will be further from us. And how do we provide those individuals with resources so that they can travel further to get to us? Or how do we deploy more resources to the community to come to them, to their doorstep?
No, that makes all the sense in the world. We come back from break. I know Kamara is going to ask a question about what makes you proud about some of the things that you folks have done. That's a sort of a loaded question. You can probably talk for 5 hours on that one too, and chat a little bit about the challenges. And Jim, as you always know, we always save some time what our listeners can do. Donate, volunteer, whatever the case may be. When we return with our friends from Father Joe's Villages, Deacon Jim Vargas, President and CEO of the organization, joined by his Chief Health Officer, Dr. Megan Partch. I'm Drew Schlosberg. You're listening to another edition of Drew Schlosberg Spotlight on the Community Show, the nation's longest-running community podcast, now in our 17th year in the beautiful Mission Fed studios here in Scripps Ranch. And Mission Fed been doing wonderful things to support groups like Father Joe's Villages in San Diego for more than 60 years. We will be right back.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg of Cloudcast Media, and we are chatting with our good friends from Father Joe's Villages, Deacon Jim Vargas, President and CEO, joined by his Chief Health Officer, Dr. Megan Partch. Drew Schlosberg's Spotlight on the Community Show is now in its 17th year. It's the nation's longest community podcast. Joined by my guest co-host with us, Kamara White. She'll be an incoming freshman at St. Martin's College in Washington State, and you've got a question for Dr. Partch, do you not?
Yes. So you guys are doing such great work for the homelessness in San Diego. Can you just tell us a story that makes you most proud of being part of Father Joe's?
Yes, of course. There are a lot of reasons to be proud of the work that we do, and I'm humbled to be a part of the team that I am able to work with. The care and compassion that they bring to what it is that we do each and every day, helping to end homelessness in each individual life is really amazing to watch. And so there was an instance over these last few weeks that really kind of stands out in my mind. We had a team of individuals who went out into the community, and they were focused on harm reduction outreach. And they had loaded up everything that they could in backpacks and bags on their bodies, and they were walking around our Father Joe's Villages campus in East Village and downtown. And so their intent was really to engage people and provide education, to provide test strips so that people know what's in their substances. And so they were giving fentanyl and xylazine test strips and talking about alerting people to what's in our drug supply, and giving sharps boxes and just talking generally about resources and trying to meet some basic needs. And so while they were out, they had remarked that of all of the individuals that they had encountered, only one individual had kind of said, "Not for me," and had actually walked away from them, which is quite polite. But the remainder of the individuals had really impressed upon them how grateful they felt to be engaged. Many individuals, they were surprised to find, didn't know what was in our drug supply, weren't aware of the risk of overdose. And so the education component really came in handy, and people were really kind of saying, "I didn't know that, thank you," and accepting resources like naloxone. So from this, there were two individuals that they had encountered of the group that had stated that they were really interested in coming back into the health center. Well, let me back up. There was three who stated that they were very interested. Two of them, though, made it into the health center within the next 2 days. And both of those individuals were then aligned with detoxification and residential treatment services. So from that outreach and engagement in the community, there were two individuals whose lives and their trajectory has completely been changed just by our team members going out and extending a hand and just saying, we're here for you. We care about you. we see you, you're valued. And so I think that that's just really striking, that when you approach from a harm reduction standpoint, when you are just there with community members acknowledging that life is difficult, but that there are ways to be safer and healthier in our community, that inevitably people reach back out and they join in. And so I'm just really proud of the work that the team does, but also especially grateful for the work that they do, because especially for these two folks, I think that that's a really moving, life-changing moment.
Well, I think what's important about this, and Jim, you and I have chatted about this quite a bit, it's just not that an individual that is the benefit. It's that individual's, tentacles. Is it now their families, that have watched them struggle on the street, and it's the cousins, the aunts. So it's not just one person that has been benefited from it. Maybe it's 10, and then there's 10 others and so forth. So that reach is huge on this. Listen, Jim, we've talked about this quite a bit. The challenge is housing. Correct.
The challenge is housing, because at the end, you can provide health care.
That's right.
You can provide shelter.
Yeah.
You provide all these services, but if you don't have housing, then you can just be so effective, right? So housing is what breaks the cycle of homelessness. I'm asked quite often, people think that quite often that what causes homelessness is mental health challenges and substance use disorder, and they exacerbate the situation. But the number one reason people are falling into homelessness in San Diego is an economic one. It's very expensive to live here, right? We know that an average apartment is $2,700 a month. We know the rental vacancy rate is about 3%. It means no sooner does an apartment come on the market, it gets scooped up, and not by our population, because it's out of their reach, right? So we need to build more affordable housing. In the meanwhile, of course, we need more shelters. You mentioned in the encampment ordinance that's gone into effect or will soon in any case. And we don't have enough shelter beds, right? So I'd be the first to say, by the way, that these encampments are not good for the individuals who reside therein. It's not healthy for them. It's unsanitary. Communicable diseases can be passed, whether it's HIV or Hep A, right? So that it's not healthy for them, not healthy for the businesses in the area, nor the residents in the area. That said, in order to be most productive, we need to be able to move them off the streets and into something, even at the interest, at an interim basis, at least a shelter bed, so that we can start working with them and working towards housing. That's extremely important. In the absence of that, what really are we doing as a community? It's not productive.
So is that going to take pretty much more than anything money that you talk about, turning some of the motels and hotels and all that business, or their unused lots or whatever the case may be. So do we have the infrastructure for it, but we need money to build things? How does that work?
Okay, it needs resources for sure, financial and otherwise.
That's right.
So we need money is actually what makes things happen, right? So we need additional funds, but we need to spend those funds in a smart way. I alluded to the fact that they can all be congregate settings.
Right, that's right.
Right, so we need non-congregate shelters as well. We need sober living areas. We need harm reduction areas. We need to meet people where they are so that we can be most effective and most efficient with the use of the dollars that are available to us, because they're not endless, obviously. And so, we need land. Right? I mean, we've been building, we've been constructing. We purchased a motel and refurbished it into 83 spanking new units. Right? So that's a way of getting at it as well. I alluded to palace structures that can be used on an interim basis as shelters as well. There's some who are working with containers, shipping containers, and converting those as well. These are all possibilities. They all have to be considered, right? What St. Teresa of Calcutta Villa affords us is density. Right, because you build up, it's a tower, it's 14 stories, it has 407 homes, so it affords you that. These containers you can't get as many on a particular piece of land,
right.
But that's a part of the solution as well. It isn't a one-size-fits-all. But the key is that we need to get people off the streets in order to start helping the community become healthier.
Right, and I know you guys are constantly, Dr. Partch and Jim, and the whole team is, you don't let any stone unturned. You are looking at different things and things you haven't even looked at. And I'm going to throw out a dumb idea because I'm very good at that stuff. Instead of mothballing destroyers and all that business, could they be used? Literally ships.
I've heard about that as well, and it's not something that I don't think has been considered here in San Diego, but I have read about that.
Yeah.
They're out they're there, right?
That's right.
They're on the water. So I'm the type of person, if you give me an idea, let's look at it.
Right.
Not all of them pan out, but we should be considering whatever, so that whatever makes sense and is feasible, cost effective, right? Because cost has something to do with that as well. We should be considering, we should be as creative and as innovative as possible.
Right. And Dr. Partch, let me ask you this before we turn it over for the last question, for Kamara. Do you see the sentiment of the general resident in San Diego County becoming more empathetic to the homeless, less empathetic? It's the same, hard to say.
I think it varies by individual, but for those of us who see it, it's so visible in our worlds and in our lives, you can't help but, have a heavy heart viewing individuals who are so vulnerable that are going without the needs, their needs being met. It's really difficult. And so I think for those folks who are able to maybe not see it, maybe you can turn a blind eye, or, maybe you can just metabolize it through the news that comes your way. But I think once you see it and you're really forced to experience it firsthand, you can't help but feel terrible for the conditions that individuals are living in. And I think many of us as community members in America's finest city want to see it be just that for every individual, for all of the people that we consider our neighbors. And so myself and everybody at Father Joe's Villages, we feel compelled to do something about that. And there's so many ways, though, that other community members can join with us towards that effort, whether it's donations, whether it's shopping at our thrift stores, whatever it might be. There's so many different ways that our community can really rally around us and the work that we do to change lives.
Well, I think that was the question you were going to ask. Is that right, Kamara?
Yeah, I was just going to ask, what can the public do to support you guys, whether donations and volunteer work? But
so many things. I'll give that to Deacon Jim.
Yeah,
there are many things, and volunteering is a part of it as well. And you can volunteer. We serve 1 million meals a year, believe it or not, breakfast, lunch, and dinner in 2 dining rooms, and we need people to help serve those meals. And so we welcome people to come and do that. But there are also other ways of volunteering. At the Village Health Center, we have paid staff, we have nurses and clinicians and the like, but people who would like to give back and want to volunteer their services should contact us in that way. Any medical health clinicians, there's a value to that, obviously. We have our therapeutic childcare center. Sometimes we have parents and grandparents, especially, who come in. Sometimes they just cuddle the kids. Right, and we all need cuddling sometimes, but especially kids, right? So something as simple as that, and that's very rewarding. Mentors and tutors and so forth are also possibilities. There are thrift stores. We have 4 thrift stores throughout the city, and you can visit those thrift stores. Wonderful quality stuff at very reduced and reasonable rates. And by the way, that merchandise there is the direct result of the generosity of your listeners, because they call us in and they ask us to come and pick up and Drew knows as well, actually, pick up household goods and furnishings.
I know it very well.
You know it very well, and through Drew's generosity as well. And we preset appointments. We have 12 trucks that go out countywide each and every single day. Those products are brought in. We either sell them or we auction them. We have cars that are donated and boats as well, and we auction them, and all the proceeds go to the services and programs.
No, absolutely. Jim, shout out the website for people to get involved.
The website is my.neighbor.org. Again, that's my.neighbor.org, and it's 619 homeless, so it's easy to remember. Of course, cash donations are good. Bequests are great as well. Your legacy, and you live on with your bequests. So there are many ways in which you can get involved. I encourage you to contact us.
Well, Deacon Jim, always good to see you, my friend, and Megan, what an honor to meet you. Thank you for the great work you folks are doing. And Jim, as we talk about quite a bit, feel free to bring in somebody that has benefited from your services, whether it's the dental services that we were chatting about, or it's the stuff that you do as well. Would love to have them on, because that's what it comes down is the street cred, no pun intended, of what happens here. We'll look forward to having you come back on sooner than later. Thanks so much.
Good luck in school.
Oh, thank you. I appreciate it.
I'm Drew Schlosberg. You've been listening to another edition of Drew Schlosberg Spotlight on the Community Show, the nation's longest-running community podcast, now in our 17th year, and a great conversation with our friends from Father Joe's Villages, Deacon Jim Vargas, President and CEO, and Dr. Megan Partch, Chief Health Officer. Kamara, nice job again. You're becoming a pro at this, and you'll be taking over my job probably next week. Okay, and that would be fine. We hope you enjoyed another edition of our show, especially the great work that's being done by Father Joe's Villages.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.